Good morning. So today we'll again continue to study the clinical examination of the sensory system. Yesterday we have seen the theoretical aspect of it, how to examine the sensory system. So today I'm just showing you the slide of the pro forma by which you will record your observation. So of course, before going to the examination, one should have a necessary theoretical understanding. It's like what is a dermatome, what is a touch, what is called absence of touch sensibility, what is analgesia, and what is aestheticness, etc. You should know the theoretical understanding, then the examination will be easy. And if you know the procedure, the things will be easy. Anyway, today I'll show you the pro forma, how you will record your observation, as well as I'll play certain videos where it is shown how things are examined. And meanwhile, I'll tell you some of the other tips too. Here you have to write the name of this individual, age, sex, etc. Then coming to the tactile sensibility, here you will be testing the tactile fine touch. And suppose if you are here, face, right, left, upper limb, right, left, trunk, right, left, and lower limb. Everywhere, suppose for example, tactile sensibility is there. Whenever he says yes, then you write yes, yes, yes. Or you can say perceived. You can write perceived. When it comes to tactile localization, so you touch a particular point on the skin. Here she will again point out the area being touched. And what you do, you try to measure the distance between the point you have touched and point the subject touched. So that you write in millimeter or centimeter, whatever the thing, you write that value here. Then comes the tactile discrimination, wherein you will use the compass or thesiometer and start with the minimum separable distance between the 2 points in the compass until you keep on increasing the distance until he says or you perceive as 2 different stimuli. Until then you do on different parts, on the face, upper limb, lower limb, and trunk, etc. Again, both on right and left side, and try to measure the distance until which or at that particular point we perceive as 2 different stimuli. So you measure the distance between the 2 points on the compass, then you try to mention those values here. Then comes the cutaneous pain, or otherwise called a superficial pain. Then you apply or you use the normal domestic pin, wherein you can at different points or different dermatomes, you try to elicit the pain sensation. And whenever you perceive the particular sensation, you write perceived, perceived on all the columns. Then here, the 6th one is the deep pain. Here, you try to squeeze the muscle or press it hardly against the bone. Then you will feel the deep pain. Or alternatively, you can pinch the tendo Achilles or any other tendon which is superficial. The tendo Achilles is the superficial tendon where you can easily squeeze, wherein you can elicit the deep pain. Then here also you write the whether it's an upper limb or lower limb, you write perceived or perceived. Then comes temperature. Here, as I said, you use preferably 3 test tubes, if not available, at least 2 test tubes having hot and cold water. Cold means not should be too cold, that it should be around 20 to 25 degrees centigrade, and hot means it should be below 45 degrees centigrade, between 40 to 50 degrees centigrade. And you keep 2 test tubes with hot and cold water. You try to touch different points on the skin, on the face, and upper limb, trunk, and lower limb. And whenever you should keep it randomly, one should not keep the subject guessing. Suppose alternatively, suppose you do hot and cold alternatively regularly, then he may pursue. So you do randomly, so that you try to test whether the sensibility is, the particular sensation is perceived correctly or not. You can do it. And the sense of vibration, as I said, you take the tuning fork of lower heads. especially 128 hertz. Then vibrate the tuning fork without touching the vibrating prongs. The base of the should be kept over the bony prominences like olecranon or maybe the mastoid process or on the medial or lateral malleolus in the lower limb, etc. And bony prominences to keep and try to ask the subject to whether they are perceiving it or not. Accordingly, you write perceive, perceive, perceive like this. Then comes pressure. For pressure, you can use a blend object such as the back of your pen, and you can do it on upper limb and lower limb, and you can write the observations. In joint sense, here it can be done in 2 points, 2 parts. One is this sense of position. Suppose what is the position at which a particular joint is there. Suppose it is in abduction, adduction, or extension, or etc. And the sense of position, you would write whether it is able to perceive it or not. Next is the appreciation of movement. What type of movement you are doing, that you should be able to perceive. And again, if asked, he should be able to move the same way what you are moving. Of course, all the examining has to be done with the patient blindfolded. That means eyes should be closed, and the bilateral examination should be done. And as far as practicable, try to stand on the right side and try to do all those things. The last is the stereognosis, that is the ability to identify a known object with closed eyes by feeling its size, shape, and texture. So that also you can give some known object, and if he perceives that, of course here you don't write right left, so it's a single thing. Whenever they do this particular thing and you write, if they fail to identify, then it's called stereognosis. This is the pro forma. Now after this, I'm going to play certain videos. Some of the expression is there, and after every video, if need arise, I will be explaining a little more detail, and try to watch the video carefully. And as you know, for the entire sensory system examination, you look at very simple things like having a domestic pin, wisp of cotton, or maybe a pen, as well as, for example, position and all. Just we need to move the joints, that's all. And stereognosis, you can give any known objects. For temperature, we can use hot and cold water. It's also available at home. The only thing we may not be having the tuning for. Barring that, all other things are available. You can start practicing even at your home. Maybe on your those are there available at your home. Maybe your brother, sister, or father, mother, neighbor, anybody can be a subject on them. You can test all the sensation and you can write your observations there. So try to practice at home also, so that whatever we teach, that becomes reinforced. So today, now I will play the video. Watch carefully.
Examination of sensory system. Sensory information is perceived by sensory receptors. Sensory receptors are modified type of nerve endings, and through sensory pathway, this information is transmitted to the central nervous system. Following sensation will be tested for the sensory system examination. They are: first is touch sense. Here, touch sensation, they are tested under following headings: light or fine touch, crude touch also known as pressure touch, tactile localization, and tactile discrimination. Second sensation to be tested, that is temperature. Third, pain, which further tested under superficial pain and deep pain sensation. Another sense to be tested, that is vibration sense. Fifth one, sense of joint position. Sixth, sense of joint movement. And seventh one, stereognosis. And graphesthesia. Let us start examination of sensory system. Sensory system must be examined with subject's eyes closed and must be compared over the identical points on either sides of the body. proximally as well as distally. Let us start with touch sensation, light or fine touch. It is tested with the wisp of cotton or tiny feather. Explain the procedure to the subject and let him or her feel the touch of cotton or fine feather, and then instruct him or her that whenever he or she feels the sensation of touch, he or she has to say yes, and as well as he or she has to mention the area touched by the cotton. For example, right shoulder or forehead, etc. Let us start the procedure. Ask the subject to close the eyes. Examiner starts with the right side of the forehead and then left side of the forehead.
Yes, right forehead. Yes, left forehead.
Then comes over the face, upper extremities, above downward, chest, first on right side, then on the left side, abdomen, and then lower extremities. Points to be noted that corresponding parts are to be tested, applying only one stimulus at a time. Just touch with the wisp of cotton and then take it off. Do not brush or make the brushing movement with the cotton wisp. Next is crude touch sensation, which is tested by one phase hair aesthesiometer. This is the instrument. It contains a standard hair. You can see here, this is standard horse hair, which is mounted with screw. A graduated cap rotating over the screw, which regulates free length of the hair. You can see that length of the hair can be changed by rotating this graduated cap. The cross section of the hair and pressure exerted by the hair is measured previously, so we can find out the minimum strength of the stimulus required to arouse the touch sensation. Depending on the skin thickness, pressure required for producing touch sensation is different. Examination of crude touch or pressure touch sensation is same as fine touch. Ask the subject to close the eyes. The hair should be slightly above the graduated tube. The examiner starts with the right side of the forehead.
Yes, right forehead.
Then left side.
Yes, left forehead.
Then comes over the face, upper extremities, above downward, chest, abdomen, and then the lower extremities. Next is tactile localization. First, give instructions to the subject that he or she has to localize with the help of a ball pen the part of the body which is touched by the examiner. Ask the subject to hold a pen and close the eyes. Touch the skin of one area of the body with the help of wisp of cotton and ask the subject to immediately localize that point by touching with pen that he or she is holding. Measure the distance between 2 points that is touched by the examiner and that is identified by the subject. This distance is known as localization distance. Sensation should be elicited according to different dermatomes of the body. Repeat the procedure on the opposite side. Localization distance is measured on the opposite side and the distance is compared with that of the other side. Next is tactile discrimination, for which we use the instrument known as compass aesthesiometer. This instrument is used to determine the minimum distance between 2 points, which could be recognized as 2 points when they are stimulated simultaneously. Here, the angle between two limbs and therefore the distance between them can be measured along the graduated area. To start with, the two limbs are separated apart. And simultaneously touched while the subject is blindfolded. He or she is asked to recognize whether he or she feels 2 points or only 1 point, and the distance between the 2 points of the compass accessometer is reduced and the test is repeated. Let us examine tactile discrimination. Ask the subject to close the eyes. Separate the two ends of the compass accessometer. Apply these two blunt points on the tip of the finger, palm, dorsum of the foot, and compare them with the opposite side. First, the distance used is more and then the two stimuli are brought nearer. The subject with eyes closed should be able to feel these points as two different stimuli. The normal distance is most minimum on the tip of the pulp of the finger. Now let us start the procedure.
2 points. 2 points. 1 point on fingertip.
Repeat the procedure on the opposite side. Next is to test the sensation of temperature. Take two test tubes containing warm and cold water separately. Give proper instructions to the subject that he or she has to say whether he or she feels cold or warm when touched with different test tubes. Ask the subject to close the eyes. Place the test tubes on the skin of the subject, each in turn or randomly, and ask the subject to say whether he or she feels warm or cold.
Warm. Warm.
Examine warm and cold sensation on all the dermatomes of both the sides of the body and note your observations.
Cold. Cold.
Next is pain sensation. Superficial pain is tested with the tip of the pin. Here, stimulus is applied with patient's eyes closed at different corresponding parts of the forehead, face, upper limb, chest, abdomen and lower limbs. Let us proceed. Ask the subject to close the eyes.
Right forehead. Left forehead. Right cheek. Left cheek.
Next is deep pain sensation that is tested by using the instrument known as algometer. Algometer possesses a broad blunt knob attached to a spring which can be pressed upon the skin and the pressure exerted can be measured. The pressure required to induce a sensation is measured in different areas. Let us proceed. Give proper instructions to the subject. Ask the subject to close the eyes. With algometer, carefully press on the surface of the body and note the minimum pressure required to produce pain. Repeat the procedure on the identical points on the opposite side. Next, let us test sense of vibration. Give proper instruction to the subject. Take one tuning fork of 120 Hz frequency and vibrate the blades by heating the blades of the tuning fork against the hypothenar eminence of the palm or against the thigh. Place the foot of the vibrating tuning fork on the surface of the body, especially on the bony prominence, like the lower end of the tibia, stylar process of the radius and medial or lateral malleolus, and ask the subject whether he or she feels the vibration. Ask the subject to raise his or her finger when he or she stops feeling vibration. Immediately place the tuning fork on the corresponding bony prominence of your body and note whether you can still perceive the vibrations. Let us proceed. Ask the subject to close the eyes. Next, sense of joint movement and joint position. Give proper instructions to the subject, that is to recognize the particular position of the limb when the limb is moved. Ask the subject to close his or her eyes. This is tested first at the most distal joint, that is the terminal phalanx. First fix the proximal phalanx. Then move the terminal phalanx a few times and put it in one of the positions and ask the subject to identify whether it is upward or downward. Let us proceed.
Upward.
Repeat the procedure on the opposite side. Make the movements at all the joints, all small and big joints, and ask the subject to recognize the joint movements. Movements of less than 10 degrees are appreciated at all the normal joints. To test the joint position, place one limb of the subject in a particular position and ask the subject to place the other limb in the same position. Next is stereognosis. Stereognosis is ability to identify the known object with closed eyes. Procedure: first give instructions to the subject, that is, he or she has to identify the object when asked to handle the object. Ask the subject to close the eyes. Place one familiar object in one hand of the subject and ask him to recognize the object by palpating it. Repeat the procedure with two or more familiar objects.
Key.
Repeat the procedure in opposite hand.
Pen. Key.
Next is graphesthesia. Here, with subject's eyes closed, with the help of blunt end of the ball pen or with a finger, you can draw different figures or numbers, that is like circle or square, either on the forearm or leg or palm of the subject.
Eight.
They should be drawn one after another.
Right.
Test on the opposite side.
Eight. square.
Thank you.
So now we have seen the video wherein she has demonstrated how the now watch this video also.
Hello, Omar. My name's Amy. May I examine you?
Yes.
I'm going to position your arms. I'm going to touch your arms with some cotton wool. Could you look up for me? Could you tell me when you feel me touch you?
Test light touch with a wisp of cotton wool and ask the patient to respond to each touch. Time the stimuli irregularly and make a dabbing rather than a stroking or tickling stimulus. Test the dermatomes systematically and compare sides.
Yes. Yes.
Does that feel the same on both sides?
Yes. 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 Yes.
Use a fresh neurological pin, not a hypodermic needle, to test pain sensation.
I'm now going to gently touch you with a pin. Do you feel this as sharp?
Yes.
And this as dull?
Yes.
Please say yes when you feel me touch you with this as sharp.
Testing the C5 dermatome.
Yes. Yes.
C6.
Yes. Yes.
C6 again.
Yes. Yes.
T1.
Yes. Yes.
C6.
Yes. Yes.
C7.
Yes.
And
Yes.
C8.
Yes.
Next, test temperature. Use a cold metallic object like the tuning fork.
Do you feel this as cold?
Yes.
And here?
Yes.
Sophisticated assessment using tubes of water at controlled temperatures is seldom performed. Now, use the flat base of the tuning fork to test vibration sense.
Can you feel this vibrating?
Yes.
Test on the distal bony prominences.
Can you feel it here?
Yes.
And is it vibrating?
Yes.
If sensation is absent, work proximally.
Can you feel it here?
Yes.
And is it vibrating?
Yes.
Next, test proprioception, or joint position sense. Demonstrate first with the patient's eyes open.
Look at your finger. This way is up and this way is down. Please close your eyes and tell me which way I'm moving your finger.
Up.
Hold the digit at the sides
Down.
to avoid giving information from pressure.
I'm going to do the same with the other hand. Again, I'll show you. This is up and this is down.
Test the distal interphalangeal joint of the middle finger.
Up.
If sensation is impaired,
Down.
move to more proximal joints in each limb. Test two-point discrimination using an opened-out paperclip. Ask the patient to look away and apply either 1 or 2 points to the pulp of the patient's forefinger.
Can you tell me whether I'm touching your finger with 2 points or with 1?
2. 1.
Test both the middle fingers and the thumbs.
1.
You can adjust the distance between the 2 points to determine the minimum separation that is resolved.
1. 1. 2.
Next, we test stereognosis, tactile recognition of familiar objects.
Please close your eyes. I'm going to place an object in your palm. Please tell me what it is.
A coin.
That's good. And this?
Key.
This and the subsequent examinations should be performed on both hands. For brevity, we show only the right. Test for graphesthesia, the ability to identify a figure traced on the skin.
Please close your eyes and tell me the number.
Use an orange stick or a blunt pencil.
8.
Open your eyes. This is your index, your middle, your ring and your little finger. Please close your eyes and tell me which finger I'm touching.
This tests the ability to point localize. Difficulty identifying the touched finger is called finger agnosia.
Index. Little.
Test for sensory inattention.
Keeping your eyes closed, which side am I touching you on?
Left. Right. Both.
Open your eyes. Thank you.
So we'll see one more video, then we'll have a final discussion. As a second video play out level. Play
buttons are
idena Yes, now
Hello,
for
Omar.
this
My
video-
name's Amy. Would it be okay if I examined you?
Yes.
Begin with light touch, using a wisp of cotton wool, or lightly apply your finger.
Please look at the ceiling. I'm going to touch your legs with some cotton wool. Please say yes when you feel me touch you.
Yes.
Time the stimuli irregularly,
Yes.
making a dabbing rather than a stroking or tickling movement. Compare side by side for symmetry.
Yes. 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 Yes.
Did it feel the same on both sides?
Yes.
Use a neurological pin to test pain.
I'm now going to touch your legs with a small pin. Do you feel it here as sharp
Yes.
and this as dull?
Yes.
Please say yes when you feel it sharp.
L2,
Yes. Yes.
L3,
Yes. Yes.
L4,
Yes.
L5,
Yes. Yes.
L5 again,
Yes. Yes.
S1,
Yes.
and S1 again.
Yes.
Do not use a hypodermic needle
Yes.
and dispose of the neurological pin carefully after each patient. Use a 128 Hz tuning fork with a flat base.
Can you feel this vibrating?
Yes.
Can you feel it?
Yes.
Is it vibrating?
Yes.
Can you feel it?
Yes.
Is it vibrating?
Yes.
If distal sensation is impaired, progress proximally until sensation is reported.
Tell me when it stops vibrating.
No.
This can be a more accurate way to test sensation.
I'm now going to move your toe. Could you look at your toe for me?
Demonstrate with the patient watching.
This is up and this is down. Can you look back at the ceiling? And tell me which way I'm moving your toe.
Up.
Hold the digit at the sides to avoid giving information from pressure.
Down.
Please could you look at your toe? This is up and this is down. Please place your head back down and look at the ceiling and tell me which way I'm moving your toe.
Up. Up. Down.
Thank you.
So we have seen the videos where how an upper limb, lower limb, as well as the whole body, how the sensor system is being examined. Now here, due to paucity of time or maybe little time, they have done only few dermatomes. It's not that simply you do touch or pain here and there. There is some logic. You try to know the anatomy of it, especially at the other day I've shown some figures where various dermatomes, the distribution of various the segment of skin innervated by a particular spinal segment of nerve. That one should be aware of which area is innervated by which nerve. Once you are aware, then for you have to test for each and every nerve. You need to test on as many as dermatomes possible on the forehead and the side, especially on the face itself. You can test for the trigeminal nerve, for the ophthalmic division, maxillary, and mandibular divisions. Like this, you have to do 3 times also, as well as neck area and the chest region and abdomen, as well as on the back, as well as the lower limb, upper limb. Everywhere you have to do as many dermatomes as possible. Not at randomly. You should go to the segment of the skin which is in a particular segment. Then you test on one side. You should also test on the opposite side. Of course, in our lab we have all the what are the instruments which are shown in the video. We have the one phrase hair aesthesiometer with horse hair, as well as we have algometer for deep sense also. So you can't say at being at home that these instruments are not available. You can touch. You can say any hair, or even suppose if you have your the knee hammer on the back side, there is a brush. So anyone such hair also can be used, or even A cotton whisk can be used for fine touch, for crude touch. As I said, you can use a blunt object, as you can use the fingertip, or you can use the back of the pen also. Especially for a compass oximeter, you can use a compass oximeter where there's a graduated measurement is there, or else even at home, you have a compass. With that also, you can increase or decrease distance. You can measure until the subject says it perceived as a two different stimuli from single to two, and on different dermatomes, maybe as fingertips, on the face, on the neck region, on the trunk, as well as back, and as well as on the lower limbs, upper limbs. You can do on as many dermatomes as possible and try to measure the minimum separable distance required to distinguish the two different stimuli. As well as you can also, and the prongs can be taken out, or you can, using a small scale, you can measure the distance. So accordingly, you can modify the test procedure being at home. For deep pain, instead of using algometer, you can squeeze the muscle or squeeze the tendon achilis, by which you can elicit the deep pain. So most of the sensation, hot and cold, you can normally you will get hot and cold water at home. You can test on as many dermatomes as possible. In the video, the first one video, of course, was good. Almost most of the sensation has been shown. There is something called graphesthesia. It's nothing but it's a synthetic sensation. It is the nothing but continuous touch. It is a synthetic sensation. Of course, it is not considered as a basic test for sensor system, but still, some others they do consider it. So you can write a number or anything, any particular shape you can draw, and ask the subject to repeat what you drawn on the skin. That also can be included. Even if it's not included, never mind. But other sensation can be even tested even at home with the minimum available things. Try to do those things at home and try to record your observations in the pro forma, which I've shown in the beginning of my today's lecture. So try to examine as many dermatomes as possible, as well as in the first video, of course, the demonstrator was standing on the left side of the subject just for the easy video coverage. Of course, as far as practicable, you try to stand on the right side of the subject and try to do bilateral examination. And most of the exam has to be done with patient's eyes closed. So this has to be taken into consideration. And I hope you can do most of these examinations, except maybe for the vibration sensation. All other sensation you can do with the homemade available things. You try to do and try to observe your the results and record it. Now, sometimes, as I said, a particular area of the skin or dermatome, it may show certain what we call trophic ulcers. What are trophic ulcers? A particular area, when it loses its sensory nerve or blood supply, nutrition is cut off, that area of the skin becomes bluish, thin, shiny, and later it may start developing certain ulcers. Because especially in diabetic patients, what they develop is peripheral neuropathy. Especially that's why the doctors advise them to have proper foot care. So some of the foot area, these cutaneous sensation is lost. So they may try to injure themselves. They may develop injury or they may develop ulcers. Similarly, those who are on the ventilator for a longer time due to the pressure points, they develop what we call decubitus ulcers. Sometimes even in leprosy patients, as the sensory nerves are being damaged, so they don't feel, they do develop the ulcers at the fingers. So these are all examples of trophic ulcers. Whenever a sensory nerve to a particular area is cut off, that area tend to get less blood supply, and again, suppose it's a muscle, the muscle undergo wasting, and if it's the skin, it start developing trophic ulcers. That also in one way of observing whether it's sensation that particular area is there or not. Those areas doesn't receive sensory nerve supply, they are likely to develop trophic ulcers. That one point one should remember. Then with this background or with this knowledge what all we have seen, now first and foremost you should know about the tracts, portion of various nerve tracts in the spinal cord, as well as the various dermatomes. And when you are examining what are the sensation you are going to test, and what are the instruments you are going to use, and how you are giving proper instruction, and how to record the results that already you have shown, and in the form of the proforma as well as the video. You try to follow and try to do as much as possible. And of course, once you come back from your this quarantine or maybe the lockdown period, once again we will give a live demonstration. We do have all the instruments, and we need to do it properly in the examination. As I said, the examination now there is a worst pipette and is followed. So what one has to give proper instruction, and you have to perform this properly. Then you have to record your results also properly. Everything carries marks. So with this, I conclude my today's morning lecture, and I wish everyone should try to examine the sensor system at home with available things. I hope you can do it. Thank you. What is